So basically, we can classify vitamins into two segments: fat-soluble vitamins and water-soluble vitamins. Vitamin A, D, E, K comes under the fat-soluble, and vitamin C and all the B complex vitamins will come under water-soluble vitamins. Fat-soluble vitamins can be stored in your body for a good time of around 3 to 4 months, depending on what kind of vitamin it is. But water-soluble vitamin on a daily basis you have to consume. Since it is water soluble, it will be leaving your body via urine and sweat. Okay. So coming to vitamin A, um, we have two forms of vitamin A, which is sourced from the food: retinols and beta carotene. Retinols are mainly from animal sources. Okay. And these are pre-formed vitamin A. Retinol will enter the body in the form of vitamin A. It is easily absorbable. Okay. So it is found only in animal sources like fatty fish liver oils, meat, tissue meat, organ meats, dairy products, breast milk, etc. And this will be easily stored in liver as soon as it is been absorbed by the intestine. Next, we have beta carotene. Not just beta carotene, there are various types of carotenes, but beta carotene is considered to be the provitamin, which is a precursor of vitamin. Beta carotene undergoes certain oxidation and then it forms into vitamin A, which can be readily stored in the body. Okay, so it is a carotene. Provitamin is called beta carotene or carotenoids in general. Beta carotene is one type of carotenoids. Okay, so it is usually found in all the red, orange, yellow fruits and vegetables like mango, papaya, palm oils, carrots, dark green leafy vegetables like spinach, amaranth leaves, etc. Fenugreek, gogu leaves, they also have good amount of beta carotenes in it. Okay, so the conversion ratio, we will discuss that. Retinol, for example, in this slide you can see this is very important. Okay, it's on page number 286. Conversion factors, just read through that. Okay, but the points which are important, it is typed here, the first 2 points. 1 microgram of beta carotene. Okay, I have used the short form of it. 1 microgram of beta carotene is equal to 0.12 microgram of retinols. Okay, so and one international unit of vitamin A is equal to 0.3 microgram of retinols. This is given in page number 286. Am I audible to all? Is my voice clear? Okay. So what does this mean is, since beta carotene is from plant sources, okay, and retinol is from animal sources, you have to consume triple the amount, okay, around triple the amount of beta carotene in grams or micrograms to get the equivalent amount of retinol in your body. That's the meaning of it. Okay, international units. Why international units is considered here? Because when you're deficient in vitamin A or when you're getting the immunization of vitamin A, it is given in international units. Okay, so it's given in syrup forms, and the syrup bottle. Along with the syrup bottle, the tablespoon to administer the syrup. Okay, it is also given. The nurses and the PHC workers, etc., they know how to calculate it. Like a full teaspoon of vitamin E syrup will be equal to 10,000 IU. Half a teaspoon will be equal to 5,000 IU. Like that, different measurements are there with respect to the tablespoon which they are providing along with the package of this vitamin A syrup. So we consider one international unit in terms of dosages. Okay, so micrograms, etc., are not considered for dosages. That is only for nutrition purpose. But from the point of view of medical purpose to prescription purposes, we use international units of vitamin A. So one international unit of vitamin A is equal to 0.3 microgram of retinol. Okay. So different forms of vitamin A and its derivatives are given in this slide. One is beta carotene. Then we have retinol. Beta carotene is directly sourced from plant sources. It has to undergo oxidation to form into retinol, which can be stored in the body. Okay, body cannot store beta carotene as it is. Okay, it undergoes oxidation in the intestine, etc., and then it is stored in the liver. Okay, so then we have retinol, which is from animal sources. You directly get vitamin A in form of retinol. Okay, again, this will retinol will undergo oxidation to form retinal. Retinal will undergo reaction with certain enzymes to form retinoic acids. Okay, what happens here is this retinol and retinal. Okay, retinol, that's it has a hydroxyl group, so it's an alcohol. Okay, retinol is an aldehyde. Okay, so vitamin A can be found in your body in the form of alcohols, in the form of aldehydes, as well as acids. Okay, in form of retinoic acid. Okay, in these three different forms, vitamin A can be stored and utilized within your body. Okay, retinol and retinal, okay, they are interchangeable. Once the body has stored vitamin A in the form of retinol, it can convert it into retinal with oxidation. Okay, and then again retinal can be transformed into retinol again if it has to store retinol back into the body. So uh, the vitamin A can go to and fro, from being retinol to retinal, from being retinal to retinol, like that. It is convertible. But once a vitamin A converts itself into retinoic acid, then it cannot go back. Okay, so then once it has converted itself into retinoic acid, and retinoic acid, we will see where and all we will find retinoic acid, and from there is no going back for vitamin A. Okay, till the level of retinal, the vitamin A can readily convert itself back into retinol. Retinol can again convert itself back into retinol. But after this level, when it turns into retinoic acid, then there is no going back. It will be stored in the soft tissues of the body like brain, spleen, bone marrow, etc. From there, it is not converted back into retinol. Okay. Yeah, about the skin and all, we'll come to that later, because prescription level retinol, or especially retinoic acid. Okay, when we are talking about retinols are that you do not require prescription for retinols. It is readily available over the counter. Okay, but retinoic acid is prescription based. You cannot use retinoic acid for topical application or even for consuming. Okay, you can't use retinoic acid without a prescription. Vitamin A is definitely good for skin. It makes sure your skin doesn't get dry. Okay, it undergoes shedding. Okay, new skin cells form. It undergo the old skin cells are undergo shedding, so your skin stays youthful. And in this way, if you have any acne, pimples, etc., what happens is when the dead cells and the dirt gets stuck into the pores of the skin, that's when it leads to acne, pimple, etc., along with certain hormonal activities also. But when you are using vitamin A as a topical application, or in your diet you have a good amount of vitamin A consumed, what happens here is your skin will undergo cell differentiation on a regular basis, so that whatever is getting clogged in your pores, it will automatically come off along with the shedding. So the skin topically as well as the pores remain clean. That's the technique mechanism of action behind using retinoic acid, etc. Okay, toxicity is there. We will discuss that at the last. That's the last topic today. Yeah, ingestion of vitamin A, if it is prescription vitamin A like Accutane, etc. Okay, retinoic acid, prescription level vitamin A, Accutane, etc. That will help with dermatological conditions like severe acne. Okay. Then coming to the functions of vitamin A, vision. In vision, the retina. Okay, retina has rod cells and cone cells. Rod cells, here we will discuss about rod cells. Rod cells will help you perceive the light. Like for example, from you come out from a bright room into a dark room, your eye requires certain time to adjust itself. Okay, so how fast your eye can adjust itself, that depends upon the amount of vitamin A that is being circulated in the form of retinol in your blood. Okay, if you have a good amount of retinol being circulated in your body, it means your eyes can easily adapt itself. Without any delay, your eyes can adapt itself very soon from dim light to dark light, or from dark light to dim light. But if you have a very less amount of serum retinol levels in your blood, it means your retina will take time. So that's one sign of vitamin A deficiency. For corn cells in retina, that will help you to perceive colors. Okay, people who are color blind, usually they have the issues with corn cells of the retina. But it has been shown that vitamin A does not help in the maintenance of corn cells as it helps in rod cells. For rod cells, vitamin A is absolutely essential. For corn cells, it will just maintain the differentiation, etc. But for its functional level, corn cells functional level, vitamin A is not that necessary. Okay, it's necessary for the maintenance and the good viability of your rod cells in the retina. So that's how it helps in vision. Growth and development, again, your immature bone cells. Okay, when you grow, your immature bone cells, they have to mature themselves into osteocytes, etc., so that bone formation will take place. If you're not having good vitamin A supply, your bone cells will not undergo remodeling properly. What happens here is, when the child is growing, when the skull and the spinal cord, etc., the vertebral column, etc., it doesn't grow as required, the it will not allow the brain to develop, it will not allow the spinal cord to develop. That will impair the growth of the child. Okay, along with that, not just the skull and vertebral column, but also all the major bone cages in your body, which gives sufficient protection to your delicate organs. Okay, that will also not grow properly, so that will lead to growth retardation, etc. So that's how vitamin A is important in growth, in maintaining the growth. Then coming to cell differentiation, as I told earlier, somebody had the doubt regarding the skin, etc. So cell differentiation, when you use vitamin A applications in form of retinols or retinoic acid topically, it will help in removing the dead cells soon, and new cells will come up. That makes sure your skin remains youthful, plump, and also you don't get acne. It's not like that once you start using vitamin A or topical applications, you will be cured of acne. It doesn't work like that. Okay, but the rate of occurrence of acne and pimple, that will reduce. Okay, that's the only thing which we can guarantee with topical vitamin E applications. Okay, it will not completely cure your skin for with dermatological issues, because there are various factors that come into play when it comes to hormonal acne, etc. Okay, then this was something about topical look. Okay, when you go inside the body, for example, let's take your respiratory system. You have small finger-like projections called cilia in your trachea, etc. What cilia does is, when a mucus is being formed in the lobes of your lungs, okay, slowly over a period of time, it comes up. Okay, from the lower respiratory system, it will come into the upper respiratory system, trachea, and when you cough out, you are able to cough out the mucus out of your body. This is because of cilia. Okay, so what happens is, when a body goes into a state of deficiency, these cilia will not differentiate. It also has to shed over a period of time. It has a new cells has to come back. Okay, come in place of them. Okay, that has to take place. Okay, it has to continuously take place. But when these things don't take place, these cilia become keratinized. Keratinized means these cilia, these delicate small finger-like projections, they become hard, and they are not able to do their work properly. That is to make sure that the dust and other infectants don't enter the lower respiratory system, and the mucus and everything that is being secreted by the lungs, it has to go outside the body. That function is compromised. So this is how immunity gets compromised. Okay, because cilia, the mucus which your body secretes, the mucus which is there in your nose, okay, the mucus lining which is there in your respiratory tract, these things are the first line of defense for your body. Okay, when vitamin A is deficient, the cilia, the epithelial cells inside your body, which lines your body, are compromised. So your first line of defense in immunity is compromised. So that's the importance of vitamin A in cell differentiation. In gene expression, it has been seen that vitamin A is able to inhibit and suppress certain neoplasmic evolutions when a child is still in the womb. Okay, so some it can when a mother is having good amount of vitamin A in her diet, it ensures that any neoplasmic mutation that may take place and that can lead into cancer for the growing child, for the child's in the child's future, that can be suppressed. Okay, so vitamin A helps in suppressing the risk of cancer in a fetus. Even the not when the fetus is inside the womb, but when it grows into the adult, etc. If the mother had good amount of vitamin A in her diet, it makes sure that the child's cancer risk is being reduced. Then we have the regulatory function, the same thing, involved in controlling the gene activity, etc. And then when the fertilization takes place, like when a sperm is able to fertilize the ovum, okay, a zygote has to be formed. Zygote means now it is a single-celled it's as a single-celled organism. It undergoes differentiation. One cell divides into two cells. Two becomes four. Four becomes eight, and so on. So when this differentiation takes place, vitamin A is necessary for this differentiation. Until and unless when the zygote gets implanted into the uterus lining, okay, till that time the differentiation continues. From a single cell, it differentiates into 1,000 lakhs and crore cells, and from there it will form into the fetal nerve structure, muscle, skin, etc. Okay, so for all these kind of differentiation, vitamin A is required. So that is the regulatory function. Then immunity, as I told earlier, first line of defense, that is one thing. Then vitamin A is also involved in the formation of antibodies and also some cellular response, like your body is able to identify infected cells. Okay, when you are getting infected with any viral infection or bacterial infection, and it has infected certain cells in your body is able to identify those cells which are infected, and it is the body will automatically kill its own infected cells. So that is cellular immune response. Vitamin A is essential to maintain that also for the production of antibodies, for cellular immune response, for the first line of defense. So that's the role of vitamin A in immunity. Then reproduction, again, the pregnant mothers whose serum retinol has been seen, it is less than 20 microgram per deciliter. In that cases, we have seen that the mothers who have such low serum vitamin A retinol levels, okay, they are at the risk of giving premature birth. Okay, they are at the risk of giving birth to preterm babies. So if the serum retinol levels are good, when a woman is pregnant, she is more capable of continuing the entire term of pregnancy. Now coming to the absorption. So this is one thing which we have to remember during all our fat soluble vitamins discussion. That is, one thing is chylomicron. Chylomicron is present in your enterocyte. Do you know what is an enterocyte? Because we have discussed about this earlier. Enterocyte. Anyone who is from a medical background, even they can explain this. What do you mean by an enterocyte? Just break up this word. It is a cell. Site means it is cell. Entero, anything which this is not intra, enter, or anything. The word when you break up this word enterocyte, entero is one word, site is another word. Entero, it means anything that is related to your intestine. Okay, intestine. Site means cell. So what is the meaning here? It is your single intestinal cells which is able to absorb the nutrient. Understood? Intestinal lining is different thing. This is this intestinal cells. Enterocyte means intestinal cell. Okay, single cell. So chylomicron is present within your enterocyte, that is intestinal. Each and every intestinal cell, yes, in your small intestine, etc., they have chylomicron. Okay, so what is chylomicron? So chylomicron is a lipoprotein. So what do you mean by lipoprotein? Lipoprotein. Again, break the word. Yeah, it is a combination of lipid and protein, fat and protein. Okay, so you can see here in this image, okay, fat or the lipid that become it is essentially a triglyceride fat here. Okay, so that becomes the inside core. Okay, this fat becomes the inside core, and the outside surface that contains phospholipids as well as proteins. Okay, so it's a chylomicron is a combination of lipids and protein. So why this is important here? Remember that we are talking about fat soluble vitamins. Okay, so whenever a vitamin is getting absorbed into the intestinal lining, okay, it has to go somewhere, it has to be stored somewhere, right, before it goes into the bloodstream. Okay, so this is the fat inner core area in which the fat soluble vitamin will get mixed up, and from here the chylomicron will be able to transport it into the lymphatic system or the or direct blood circulation. Okay, this is how chylomicron helps in transporting as well as storing all the fat soluble vitamins. Okay, so before the absorption, etc., even before the a food that is rich in vitamin A, even before that reaches your intestine, there are things that has to be absolutely necessary in the stomach. That is secretion of bile juice, okay, and presence of bile salts in this bile secretion. Okay, along with that gastric juices. Okay, these things are important. If there is a very reduced secretion of bile salts or bile juices, your vitamin A will not be absorbed properly. Okay, if there is any, like if somebody is suffering from gallbladder stones or liver stones, something like that, or their liver function is compromised, in that case also, vitamin A absorption will not be adequate in the small intestine, because the presence of bile salts and bile juice is absolutely necessary for vitamin A absorption. Along with that, even if you, like for example, if somebody is diet conscious, okay, who are looking into weight loss program, etc., remember that do not cut off the fat entirely from your food, because even in this case, at least 5 gram of fat per meal is required for vitamin A to be absorbed from the small intestine. Okay, yeah, about vegetarians, etc., sources is given the textbook. We'll come to that later. Okay, first we'll cover the technical areas. Yeah, where was I? Yeah, 5 grams, at least 5 grams of fat has to be is necessary for the absorption of vitamin A. Fatless food will not aid in absorption of vitamin A, even if it is how much of a rich food of vitamin A you are having, it will not help. So fat should be present, but your bile secretion should be appropriate. You should not be suffering from any gallbladder stones, etc. It has to be clinically treated if you are diagnosed with such cases. And along with that, 75% of vitamin A, dietary vitamin A or beta carotene will be completely absorbed. Okay, and in case of beta carotene, the plant-based retinol, okay, plant-based retinol, that is absorbed comparatively quite less as compared to the animal-based retinols. Okay, so here coming to the absorption and transportation part. So you can see here in the green area, okay, beta carotene, retinal esters or retinol, which is found from the animal source. Okay, these forms of vitamin A will be directly absorbed by the intestinal lining, and you can see that there are 3 blocks of cells here. This each block is an enterocyte. Okay, now you understand what is an intestinal lining and what is an enterocyte. Okay, this entire area we will call, which has this finger like projections, okay, we will call these as the intestinal lining. Okay, this one single green block, okay, that becomes the enterocyte, okay, intestinal cell. So cm is the short form for chylomicron here. Okay, so beta carotene and retinol, they will convert themselves into retinal esters. Okay, only when they form themselves into retinal esters, then only chylomicron can absorb them into the fat core. Okay, and then transport it into the blood circulation or lymphatic circulation. So chylomicron will go into the blood circulation, and from there it will deposit this chylomicron, which consists the retinal esters, into the liver cells. Hepatocyte means what? At least 5 grams of fat per meal. Okay, because per day, if you're an adult, per day your fat consumption should be at least 35 grams, 30 to 35 grams. Yeah, hepatocyte means, again, break the word, hepato, anything related to liver, cyte means cell. So chylomicron will come and deposit these retinal esters into hepatocyte. In hepatocyte, again with the help of liver enzymes, oxidation, etc., retinal acid will convert itself into its original form, retinol. Okay, and this retinol will stay in the liver for about 6 months. Okay, your liver is able to store vitamin A in the form of retinol for at least 6 months. Okay, and whenever the body requires, like your eyes requires retina, your entire body requires retinol, vitamin A for different cell differentiation, etc. At that time, your liver will secrete, release this retinol out into the blood. Okay, again, retinol cannot be directly released into the blood as it is. It has to be released along with some protein. So we have RBP, retinol binding protein, RBP4. Okay, or you can call it RBP itself. Okay, so along with retinol binding protein, this protein will bind the retinol, and along with this combination, they will be secreted out into the released out into the bloodstream. And from this bloodstream, wherever the blood reaches in the soft tissues like brain cells, again back to the liver, spleen, pancreas, muscles, okay, wherever the blood goes, it will deposit the retinol there, and here the retinol will convert itself into retinoic acid. Once it has been converted into retinoic acid, can it go back into the form of retinol? It cannot. Okay, so that's what we had said earlier. Retinal esters means retinal, etc. Okay, retinal can also become retinal esters. This you have said, retinol has converted itself into retinal esters. Retinal esters converted it back into the retinol. It is going to and fro, but once retinol reaches the soft tissues, once the liver secretes out retinol, it reaches the soft tissues, it has converted itself into retinoic acid. Okay, this retinoic acid cannot be converted back into retinol. It will be used up by this soft tissues for cell differentiation purposes. Yeah, RBP4, it's an enzyme, etc. And protein which is already present in the body. Liver cells has that. Okay, liver cells will secrete these enzymes which contain this particular protein, and it will do its function. So yeah, this is where prescription comes into play. Okay, so you see this retinoic acid here in the blue segment. That any prescription that contains retinoic acid, you cannot purchase it over the counter. Okay, it has to be given to you by a dermatologist or any other physician who is dealing with your medical condition. Okay, retinols, retinaldehyde, okay, these things are readily available over the counter. Okay, now earlier retinaldehyde was also not available, but now retinaldehyde is also available over the counter. Retinols are available, you can find them in your cosmetics, in your serums, etc. But retinoic acid in form of Accutane, if it is ingestible, retinoin, if it is topical application, it is done only under prescription. Okay, remember that. So this is the absorption and transportation of vitamin A. So storage, again, carotene and retinol, which is ingested with the help of chylomicron, transported into the liver. Okay, here esterification and storage will take place for at least this retinol will be stored in the liver for at least 6 months. So 90% of the vitamin A which you consume, it is stored in the liver, and only few amount of it will go into your soft tissues like muscles, spleen, bone marrow, kidneys, lungs, etc. Esterification, when the retinol is converted back into retinal esters, etc., like retinaldehyde. That's a chemical process. So now coming to carotenoids. So carotenoids, like we say that beta carotene rich foods are like yellow, orange, red in color. So carotenoids is the element that gives this color. Okay, gives this pigment to these fruits and vegetables. Okay, so their vitamin activity, their color, and they also have an anti-carcinogenic activity because they can prevent cancer to an extent. Okay. So carotenoids in general around the nature, you have approximately 600, more or less 600 carotenoids is found in the nature, but all of these carotenoids are not ingestible. Okay, all of these carotenoids will not give you retinol after the oxidation process, etc. Okay, only about 60 types of carotenoids from this 650 to 60, only these amount of carotenoids can be used for nutritional purposes. Okay, so among these 50 types of carotenoids, we can classify them into these sections: alpha carotenoid, carotene, beta carotene, lycopene, lutein, and beta-cryptozanthine. Okay, from all these types of carotene, which do you consider that it has the most bioavailability? You have 5 types of carotenoids in front of you. Which do you think has the best and a good bioavailability? It's beta carotene. Okay, any food that is rich in beta carotene. For example, if you have a food that is rich in alpha carotene, 100 grams, beta carotene 100 grams. Okay, it is always the food that is rich in beta carotene that will be easily and completely absorbed by the, not completely, but at least 75% of that particular beta carotene will be absorbed by the body fast, and it can be utilized much more easily as compared to other types of carotene. So remember that beta carotene has been studied as the best bioavailable form of carotene. Okay, other foods do have lycopene, alpha carotene, etc., but their bioavailability is reduced in comparison with beta carotene. Okay, the different types of sources of alpha carotene, beta carotene is given in this particular image. You can take a photo of this and read it in your own time. You will understand. Okay. So experiments on human beings have revealed that beta carotene in food is better absorbed than any other forms of carotene. Okay, and also when it comes to beta carotene, for example, the beta carotene which is there in papaya and beta carotene which is there in carrots, which do you think will be easily absorbed? We are talking about the same type of carotene here, beta carotene. Okay, the beta carotene is present in carrots, beta carotene is present in papaya, which is easily absorbed. The beta carotene which is present in papaya is easily absorbed as compared to carrots. It is given in your textbook. Okay, a small table is also given, table 15.1. Please read that. Okay. The reason is along with beta carotene, there are various other minerals and nutrients which is found in this particular fruit and vegetable. Okay, they will also interact with each other, and there are various other factors, okay, that the food biologists and chemists, they must have found out the reasons, etc. Okay, so for your information, in the textbook 15.1, okay, a small table is given. There are some amaranth is also given as an example, but when you compare with the bioavailability, the absorption range of amaranth as compared to the fruits and vegetables, okay, amaranth obviously it has beta carotene, but the absorption level is quite less. Okay. Yeah. Next, coming to the health benefits of beta carotene, it has anti-cancer. It is anti-carcinogenic, so it can reduce the risk of cancer, especially female reproductive cancer, gastrointestinal cancer, oral cancers, okay, lung cancers. Cooking, we will come to this thing. Cooking, which kind of cooking method should be used when you are dealing with food which is rich in beta carotene, okay? Because when you expose beta carotene to heat, okay, it destroys some aspects of beta carotene. Okay, beta carotene is unstable, becomes unstable when exposed to heat. So there are few tricks and few tips which you have to incorporate when you're cooking foods which is rich in beta carotene. We will come to that later. Okay. Cardiovascular disease. Uh, they had done some study. From the a result of that study is given in the textbook. Okay, so the study was men who had a history of heart attack. Okay, who had a history of heart attack, had a previous episode of heart attack. To them, a sufficient amount of beta carotene rich food was given, and it was seen that their angina levels reduced. Angina means the chest pain. Okay, the frequency of chest pain, those things reduced. Okay, their lifestyle became better. Okay, so the second episode of heart attack is obviously reduced. If the angina is reduced, means the coming up consecutive episodes of heart attack will also be reduced. So that's how beta carotene helps in cardiovascular disease, reducing the intensity of cardiovascular disease. Cataracts, we have seen that for vision how important it is. So people who are deficient in beta carotene, they have 5.5 times higher risk of getting cataract soon. Okay, gastric inflammation, it has anti-inflammatory property also, beta carotene. Especially it will inhibit and suppress the Helicobacter pylori. Helicobacter pylori is a bacteria which when infects your stomach, it gives you peptic ulcer, like stomach ulcers. Okay, Helicobacter pylori. So it has been seen that it inhibits the work of Helicobacter pylori. These are the health benefits of beta carotene. So food sources that are rich in beta carotene, again, vegetable food sources are given here, vegan and vegetarian. You can see this, take a screenshot of this. Green leafy vegetables like kale, etc., asparagus, kale, etc. If it is not available, it's not available in the Indian market that easily. Okay, if at all you're living in metro cities, it is much more accessible for you. But those who are living in rural areas or suburban areas, you can go for amaranth leaves, fenugreek leaves, cocoa leaves, etc. That is also a good source of supply of beta carotene. Muskmelon and cantaloupes, they come under the same category. Okay, it is called cantaloupe in some part of the world, and other areas we call it as muskmelon. Also in India, I guess we call it as muskmelon, not cantaloupe. So RDA, for an average man who is 65 kg, okay, 1000 microgram of retinol is required. So the retinol that is coming from animal sources. Okay, so if it is coming from if your vitamin A requirement is coming from plant sources, you will require 6000 microgram of beta carotene to equivalent 1000 microgram of retinol. Okay. For man and woman, hardly there are just 150 to 200. That is the difference here. So women can also go for a target for 1000 microgram, but like the upper intake is there. Okay, upper intake is there. Like no, do not cross this limit uh, on a daily basis. Okay, there is a vitamin. There is a chance of vitamin A toxicity, but remember, vitamin A toxicity will not happen overnight. Okay, right. If somebody is suffering from hypervitaminosis, vitamin A, that is the toxicity of vitamin A, it took place over a period of time. Okay, within one night, overnight, nobody gets vitamin A toxicity. So usually, adult females, adult males, pregnant, lactating females, etc., they all can keep a target for an RDA of 1000 mg per day, but do not cross 2500 mg per day. RDA table is mentioned in your textbook. It's on 15.3 table, page number 295. Please follow that. Okay. In the sources table, there is one more sources table. We'll come to that. In that, per gram, how much beta carotene you will get is given in the textbook. Okay, I'll mention that. So if you have a kitchen weighing machine, a small weighing machine in your home, you can obviously buy it from online also. It's within 500 rupees, you will get it online. So you if you are so if you want to follow the gram aspect of it, the portioning gram aspect of it, you can buy a kitchen weighing machine, and accordingly what is given in the textbook, you can follow that. Okay. So sources, again, how much vitamin A is present in foods. So see, 50 gram of raw spinach. Okay, to your daily requirement should be around 200%. That can give you a good amount. Okay, or 100% somewhere here. But 50 gram of raw spinach can only provide you this much of 42% of daily recommended variety. And then a sweet potato is much more better option. But yeah, carbohydrate, your intake of carbohydrate will rise when you go for a sweet potato. Okay, your intake of fiber will rise when you go for raw spinach. Okay, so that those all things you have to keep in mind. And then yeah, anything that is made up of liver. Okay, organ meat liver. So you can see how much of vitamin A it will supply in comparison to these foods. So coming to the sources of vitamin A, animal products for non-vegetarians and vegetarians. Even better than the tissue meat or muscle meat, go for the liver, organ meats. And liver is the most commonly used organ meat for non-vegetarians. Even in some parts of India, you can see kidney meat, brain meat, and all of those things being sold, but it's not palatizing or appealing to everyone. But those who do depend on non-vegetarian food, poultry or other red meats, okay, for them, I guess liver meat is much more palatable. Okay, then we have eggs, egg yolk, and dairy products. Okay, these are the good sources of food for non-vegetarians. For vegetarians and vegans, orange, red, yellow fruits and vegetables, green leafy vegetables. So here again, I have mentioned table number, two tables. Okay, one table is for non-vegetarians. It's on page number 297. And for vegetarians, the plant sources, it is on page number 298. Okay, if you have the textbook with you, please go to page number 298. On two part it is given. Okay, total carotenoids which you will get, and 100 per 100 gram of this servings, how much carotene you will get. Okay, it is given. Okay, per 100 gram of drumstick leaf, fenugreek leaf, gogo leaf, spinach, coriander, mint, amaranth, tomato, mango, carrot, orange carrot, curry leaves. Okay, per 100 gram of these plant sources, how much carotene, beta carotene they will provide you. It is given in the textbook. Okay, please read that. It will be much more. Yeah, when you are choosing a vegan lifestyle, this is a drawback in that. Okay, see, not just vitamin A deficiency. Okay, but various forms of deficiencies, not just limited to vitamin A. We have in every class I do mention that. Okay, various forms of deficiency will be coming along with that. Okay, until and unless you are very strict with your nutritional status. Okay, you're getting your blood work done regularly, you are following the required amount and required types of food in your vegan diet, you can still recover from this deficiency. It's not a big deal. But yeah, if you manage to stick to only one monotonous type of diet, even in vegan diet, that will lead to various forms of deficiencies. Okay. In vegan diet, please make sure that you do not have meat or dairy products or any animal products. Other than that, you will be good, because plants products are sufficiently rich in beta carotene. But you have to bulk up. Okay, like for example, the vitamin A which 100 gram of meat will give, okay, maybe you may require 300 of that serving to to provide the same amount of vitamin A. Okay. So coming to the tips in cooking and all, okay. So do not wash the vegetables after cutting them. Before cutting them, wash them, because after you cut the vegetables and wash it, most of the 30 to 40% of the beta carotene will be lost in vegetables. Okay, so washing them before you cut them will reduce that kind of loss. Also, when you are frying the food, etc., beta carotene is lost. Instead of that, you whatever food sources you have in your hand which is rich in beta carotene, steam cook it or pressure cook it. Okay, or at least use a lid while cooking. That will help to prevent the uh, to minimize the loss of beta carotene. Okay. And if you are cooking some food items in oven or microwaving something, that will also lead to loss of beta carotene as compared to steaming it or pressure cooking it. Okay. And if you are dealing with green leafy vegetables for your vitamin A purposes, add a tomato along with it, because the lycopene which is present in tomato, that will help to protect the loss of vitamin beta carotene. Okay, these tips and tricks are given. Air fryer, I don't know about it because it is not mentioned in the textbook, but I guess it does work. So air fryer also will work on a high heat, right? And when the heat quotient is increased, automatically it is directly proportional to the loss of beta carotene. Okay. And oils, when you're using just for sauteing, not deep frying, just for sauteing your vegetables, that will also help to protect the loss of beta carotene. So these tips and tricks you can use. Carrot pickles will not give you good amount of vitamin A, because once you store a carrot after pickling it, when you store it for more than 60 days, it is less, the beta carotene level comes down to only 10%. So do not depend on carrot pickles, etc., for your beta carotene requirement. So yeah, this kind of tips are given on page number 297. A small paragraph is given, just read through that. Remember that if you are using beta carotene and you're cooking beta carotene in any cooking method in which you have to use high heat, okay, for a long period of time, you are destroying the beta carotene. Okay, the beta carotene levels, the bioavailability levels of beta carotene is coming down. Remember that heat is going to destroy the maximum number of beta carotene available to you. So next option is leaf curd. So vegans can try this thing. Okay, leaf curd. And even for kids who, like, you can't expect kids to have such a bulky amount of, especially the kids who are at vegetarian diets, you can't expect them to have too much of fruits and vegetables. Okay, given to the tantrums they may throw around. Okay, so leaf curd is another option here. Leaf curd means um, you extract the juices of the leaf, and that will undergo the curdling process, etc. So you can check any YouTube videos regarding how to prepare this, because what happens here is when you consume 100 grams of, let's say, spinach leaves, or you or 100 grams of amaranth leaves, okay, the amount of beta carotene these fresh leaves can give you if you are consuming the same 100 grams of the curd made by these leaves, okay, this curd can give you around 100 to 200 times more beta carotene as compared to freshly consuming these leaves. So that's a very good alternative here. Okay, even especially for vegans who want to uh, who want to take care of the protein requirement in their diet. Okay, if you are this not just the mineral requirement but also the protein requirement for the vegans, that can be covered with these leaf curds. Okay, so please search about this in Google or in YouTube how to make it, etc. Or if it is available readily in the market, you can depend on this. Vegans can depend on this for their protein as well as mineral and vitamin requirement. It's a very good source of these areas. So coming to toxicity, yeah, read the statement here, which is given in red. Vitamin A toxicity can take years or decades to manifest. It will not happen overnight. Okay, so what are things, what are symptoms we will find in case of hypervitaminosis A or vitamin A toxicity? Increased cerebrospinal fluid, CSF, cerebrospinal fluid, generalized weakness, fatigue, headaches. For adults, we have seen a lot of hair loss and nail infections happen. Okay, dermatological issues like skin drying, too much of skin peeling and drying, because as I told earlier, vitamin A leads to skin differentiation. Okay, and if there is too much of vitamin A, okay, too much of skin is going to get differentiated, and that leads to the dry flakes and the peeling of the skin which you see. Even when you are going under this dermatological treatments like acid peels, or you are under the treatment of tretinoin, topical tretinoin, or you are under the prescription of Accutane, etc. Okay, this is the first thing the dermatologist will tell you, to use sunscreen, because your skin will be very dry, it will be inflamed, as well as it will be peeling. Okay, those who are taking Accutane, those who are under tretinoin treatment, etc., their skin will be very dry, and every day when they wake up they will see uh, skin which is peeling out. Okay, that is because of the hyper differentiation of things that is skin that is taking place. Okay, upset stomach, nausea, vomiting. Yeah, nausea and vomiting is also associated with these prescriptions of Accutane. Okay, nausea and vomiting is associated with that. Hair loss, nail infections, bone and joint pain, liver and spleen enlargement, because in liver the vitamin A is stored in the form of fat droplets. Okay, fat droplets, in the form of fat droplets in each liver cell, vitamin A is stored. So what happens when there is too much of vitamin A? Too much of fat droplets will be stored in the liver. That will lead to liver and spleen enlargement. Toxicity is a clinical condition which has to be dealt medically. Okay, as nutritionist or dietitian, you cannot deal with it, because symptomatic management has to be given from a healthcare facility. First, you have to rule out the toxicity with serum retinol levels. Okay, with the help of serum retinol levels, you will understand if a person is suffering from toxicity or not. Accordingly, it's the physician's job then to correct the toxicity levels, etc. It's quite life threatening. If it is not treated, it is a life threatening condition.